So what's the difference between functional medicine and conventional? So they're disease-orientated. So by the time you got the full-blown autoimmune disorder, they'll put you on a steroid. That's how they fix it. It doesn't fix the cause, they just fix the symptom. It's doctor-centered, so you go to a doctor. So this is where it comes into where doctors are compartmentalized or specialized. So these two kind of go together. So you're losing your toe because the blood supply is not there, and it gets infected, so you lose it. And then another patient comes in, and so they see a surgeon for the toe. And you have a hardening of the arteries, a heart problem. Well, it's all the same disease. It's all from sugar and eating bad. So if they all got together and said, let's fix this person's diet, they wouldn't lose their toe from diabetes. They wouldn't lose their heart problem because they eat so much sugar. So they now have them on all kinds of medications for each one of these things without treating the cause. So, and believe me, sometimes we need medicine. So when you have Crohn's disease, we treat that. But I need to put the fire out because they're on fire in their gut and diarrhea every day and they're not getting any nutrition. So we will get them to the doctor to put them on steroids for 60, 90 days. And then we'll work on their diet after that. And we actually put them on a carnivore diet sometimes for 30 days. Then we switch it to vegetarian diet for 30 days. And then we'll switch it to more of a Mediterranean diet, and then they're safe. So, and we fix it, and you can reverse this stuff. So, but so it's not as simple as you think because it's pretty complex, the body. But we've got it down now for pretty much all autoimmune disorders, and heart disease is pretty simple. So people don't realize you just eat an alkaline diet. If you're on they took a bunch of patients on triple bypasses. They're on our fourth one. This is a medical study. They're on our fourth triple bypass. And they said, no, we're not doing another triple bypass. We're going to put you on an alkaline diet, which is fruits and vegetables only. Lots of green lettuce and stuff like that. Sure enough, all of them reversed. They're no longer hardening of the arteries. They inject the dye into the bloodstream, it's all opened up again. And it was only 6 months, 2 years they reversed and never needed anything. Wow. That's our disease. That's how easy it is to fix. But they want to do surgery, cut you open, and all that stuff. So that's the kind of stuff we know. And the alkaline diet is not just that stuff, it's everything. Every disease in the world gets fixed with an alkaline diet, up to a point. If you're too far gone, maybe not. But heck, a third triple bypass is pretty much too far gone and they reversed. So it takes a lot to not reverse. This diagnosis is based on symptoms. So you have a headache, take an aspirin, but what's causing the headache, right? We don't go by symptoms. We go by symptoms, and then we look for the cause. Early detection of the disease is what they do. So whereas functional medicine is health-orientated, so they try to keep you healthy or make you healthy. So patients, and they do that, it's patient-centered, so we spend a lot more time. So MDs, they're on a schedule of 5 minutes, right? Because insurance companies cut them down so much. I mean, I feel sorry for them. They're cut down so much by United Healthcare and Cigna. They're just not getting paid anything, so they got to rush through it really quickly. So it's not their fault, it's just the way insurance works. So they're not spending time with you, so that's where the problem is. So we in functional medicine do spend time with you. We sit with you for many, many hours basically and get to know your health and start different protocols all the way to get rid of certain things. And it is complicated, so we start all these protocols, and then it gets simpler, simpler, and simpler, and then very few things show up, and then it gets really simple.